disruption. We thought there might be a week or two where it would be in the new old or the old new, leaving at 1:45, but that's not going to happen now. It will, as of Tuesday, it will leave at 12:30.
As of Tuesday, September 3rd.
That's right.
So what happens if it's the old brochures there and people look at this and say, oh, I've only got an hour to get up there? How are they going to know that it's been changed before they sort of book their
So the bus driver is already aware, and we're going to give him cards to hand out to people as an insert to the rider's guide.
Okay.
We're hoping to get some stickers to go over the Route 40, Route 41 page so that we can just stick it on there and make it easier. And, you know, just word of mouth, basically, letting people know that it's not going to change.
Jim?
Thank you, Madam Mayor. You'll also have the update on our website about the transit times?
That's right, and BC Transit is working on that right now to make sure that that's updated correctly.
Oh,
yeah, or just linked to
just
BC
linked
Transit.
To theirs. Okay.
Yeah, that's right.
Thank you. Yeah, the stickies over the brochures would be good.
Yes. Yes, so that's what we're working towards. So the purpose of this report was because we thought there was going to be a short disruption and you might be getting complaints from people, but that won't happen now. So that's a good news story.
Well, thank you for getting right on top of that and noticing it. First of all, it was Jeanette that noticed that this was, you know, this didn't fit properly, and it was different from what we were expecting, right?
Actually, I wasn't the only one that noticed it, and it was brought to my attention too, and when there was about 3 others that noticed it, so we all got together and got some corrections made.
Well, thank you very much for sorting this out, so we don't have to, this was for information, but we have good information
We have good information for a change.
Anybody have any other questions? Thanks, Ms. Van Vienen.
You're welcome.
So are we up and running now? Oh, good. So we will now go back to the first item on our agenda today, and it's a delegation from the Healthy Communities Program. And we have a presentation from Tanya Osborne and Faith Kwong. So would you like to come up to the microphone? And thank you and welcome.
Thank you. Thank you for having us. Before we start, I'd like to acknowledge that we're meeting on the converging ancestral, traditional, and unceded territory of the Silk Nation. I am Tanya Osborne, a community health facilitator with Interior Health, and with me today I have Faith Wong, who is also a community health facilitator, and she is here with me co-presenting today as a training opportunity. Thank you. So today we're going to be talking about IH and our Healthy Communities program, talking about some of today's health challenges and what influences health. I'm going to touch base on the BC community health profiles as well as some local data, talking about the importance of collaboration, how local government can influence health, and how our Healthy Communities team can help support that. There's a little bit of historical context that I'd like to bring to everyone's attention, and end with a request for a motion in council. So our program strives to support strong collective action to promote, improve, and protect the health and well-being of our communities. We work at the population health level, working upstream to augment and create environments that keep people healthy so they can avoid having to access the healthcare system. We work exclusively with local governments on processes, planning, facilitation, advocacy, engagement, and more. This is our team for the South Okanagan, our medical health officer, Dr. Sue Pollock, who unfortunately was not able to join us today. But we also have our public health dietitian, Christy Estegard, tobacco reduction coordinator, Jacqueline Duncan, and myself as your community health facilitator. And as your community health facilitator, I can connect you with colleagues throughout Interior Health. Different programs, departments help to kind of be the navigator, because we do know and understand that IH is a huge, complex organization. So just a few quick facts about Interior Health. We cover a huge geography. We cover 60 municipalities, 54 First Nations communities, 16 chartered Métis communities, 10 regional districts, and 16 school districts. Our smallest community is under 200 people, and our largest is over 125,000. So as mentioned, Interior Health is a large organization, and most people are familiar with the service delivery aspect. But Interior Health is so much more than just that, and our area that we come from is population health, and we focus on health promotion and prevention at the community level. If you just flip forward one more time, thanks. So, health data tells us that British Columbians are changing, and not for the better. 1 in 3 British Columbians has at least one chronic condition, and 1 in 4 adults are obese. Many are not active enough and struggle to buy healthy foods. Our population is aging, and so are the demands on our healthcare system. The good news is that we can build the conditions to support health and well-being for all British Columbians. And these conditions for health begin right here where we live, in our communities, where we live, learn, work, and play. So many people might be surprised to learn that what has the greatest impact on our health is not what you might first think of. When I used to think of health, I used to think, well, healthcare, first thing that comes to mind. Healthcare actually only contributes to about 25% of our overall health. The vast amount of what makes a person healthy is our social, economic, and physical environments. So having access to healthy food and transportation options, our income and education levels, as well as our social networks and having access to social services all play a role in determining our health. And while many people believe that it's the individual factors like smoking, exercise, and access to health care, the Canadian Medical Association has actually found that the social, economic, and physical environments contribute to 60% of what makes us healthy. And so if we want to try to prevent chronic disease, we need to shift our focus away from individual factors and towards large-scale community-level changes. So the Provincial Health Service Authority has created BC Community Health Profiles. They're available online as well as in PDF format, and they contain a wealth of health information on every municipality in BC. Data can be very helpful, especially in roles such as yours, but we do have to keep in mind that the data does not necessarily tell the whole story. The following slides, I'm going to be looking at some data specifically from the Asturias health profiles. So this is the population age distribution of Asturias, and as you can see, there's a very large aging population, and there's not as many younger generations coming up behind to take care of our elders, as well as to continuing to contribute to the economy. That being said, a lot of people move to this region to retire, and so that definitely could be influencing what we see in this graph. So the top left graph shows that there's a gradient across Canada between a person's income level and that of their perceived health. The higher level the income, the higher level people report as having good or excellent health. And you'll notice that Asturias health average household income is lower than that of the BC average. But please keep in mind that the BC average contains the incomes from those that live down on the coast, and they tend to have much higher incomes, and that could definitely be skewing the data. And the bottom the bottom right shows that of the education levels within Asturias, and it was quite interesting to look at it because lower income communities tend to have lower levels of education, but that is not the case within Asturias. Your population is quite well educated. So on to the next. The top graph shows that there's a high dependence on cars to get to work, but it is nice to see that there's over 13% of people actually walk to work, and this might be influenced by the fact that your community is so small and things are within close vicinity of one another. The bottom graph shows that people in Asturias are dying 3 years earlier than the BC average due to motor vehicle accidents. Keep in mind that rates of motor vehicle accidents do tend to be higher in rural areas, but this is still really good information to keep in mind when we're looking at how we're planning and building our roads. This last graph is from the Early Development Institute, and it shows the vulnerabilities of children in early childhood. The EDI is a good predictor of adult outcomes, including the social, health, and education. For example, children who are vulnerable in kindergarten are at least twice as likely to experience academic failure in later grades. So I will hand this over to Faith to talk to you about some of the next factors.
So it has been recognized the greatest contribution to the health is over the past 150 years by local government. So this could be neighborhood design, sanitation efforts, health promoting policy, programming, and bylaws. However, we know that the local government can't do it alone, and health is a responsibility of all sectors. So it's not just the local government and not just the health authority. So Ontario Health is committed to collaborating and partnering with local governments and community stakeholders to create environments and healthy public policies that support community health. So when I talk about healthy public policies, I mean the development of policy in non-health sectors. So this could be transportation or food policies that are designed to improve the health of the population. So these types of policies are especially important at the local level because many of these factors influence our health in our communities where we live, work, and play. So how can the local government influence health? As you can see on the screen, there's a ton of bubbles. There are many areas in which health lens can be applied and have a positive effect on the health and well-being of local citizens. So as you can see, the official community plan, the social planning, recreation, agriculture, so on and so forth. And I know Tanya has told me that it's the town of Osoyoos has a smoke-free policy already in place, and that work is also underway on becoming age-friendly. I know that Mayor Sue, you guys are talking about the OCP, so we are looking forward to supporting you on the work on the upcoming housing needs report. So how can our healthy communities team help? So we want to be able to build and establish partnerships to support healthy community planning and action. We want to provide health evidence and context for municipal planning processes, including rezoning application, OCP reviews, and transportation plans. As Tanya already touched, IH can be pretty complex, so we're also here to help navigate the IH system. We can help support and build capacity by supporting grant application processes, including writing letters of support or reviewing applications, participating in local government or community committees, also help facilitate or participate in community workshops. One more thing we can do is share resources, tools, best practices, and community success stories. One of these ways we share these resources is through our Healthy Communities e-newsletter that hopefully you guys all subscribe to, but if you guys are not, please let us know and we'll get you on the list. So what happens when we partner? Well, the Healthy Communities program has been existent for over 7 years now, and we've had the great opportunity to be able to provide health and equity lens to many planning projects. So on the screen are just a few examples from across the Okanagan. So to recap, when we work with local governments, we work on the processes, planning, facilitation, advocacy, engagement, education, and more. So back to Tanya.
Thanks, Babe. So some of you may or may not be aware that back in 2013, the town of Vesuvius and IH agreed to partner to increase actions to promote health within the community. This partnership involved becoming a member of the Okanagan Smilkameen Healthy Living Coalition, which did a lot of great health promoting work throughout the region. Unfortunately, the Okanagan Smilkameen Healthy Living Coalition was unsustainable without coordinator funding and had to fold as of January of this year. So we've come here today to inform you about the type of support that we're able to provide for you, as well as to ask the town to continue our partnership to promote health and wellness whenever possible to continue to partner whenever possible to promote the health and wellness of the community and reduce the risk factors for chronic disease. Sorry, that was a tongue tie.
Well, thank you very much. When I was looking through this, I thought, I think there's quite a few things that we are doing, and I think we keep it in the back of our mind. And certainly with our OCP, it's going to be brought up again, and it's certainly one of the areas we'll look at. I'm not sure whether you have, I'll let council have a chat, whether you can see or whether you know, are there areas that we should be improving on, or do you have that information, or should we be looking at something that...
That is definitely something that we can work with staff to take a look at. We do have a few different community scans that we have done in the past, and it looks at a variety of different factors. If you are looking for areas to improve, that's something that we could do. We're here to help support you in whichever health direction you choose. So if that is of interest, we can definitely do that. I've talked with Gina about the housing needs report as well as the OCP, and so right now we're going to start there. But
having that section
Correct.
Brought up at the OCP. Okay, good. Councillor Rhodes and Councillor King.
Thank you, Mayor McCordoff. Well, thank you for the presentation. I was a little saddened that the Healthy Living Coalition kind of ceased to exist. I never really knew the reason why or anything, but it was kind of sad news earlier this year. I wanted to kind of echo Mayor McCordoff's comments and drill down to the tobacco reduction part of it. I'm a big anti-smoker advocate in our community, and if it was up to me, nobody in this world would smoke, and if they did, they'd be in prison. But that's a little radical, but it helps explain how I feel about it. You know that we do have a bylaw, and I'm assuming that probably you have not really scrutinized it very much, but I would definitely be interested in areas of improvement that we may be missing, or things that we could introduce in that area as well. So if there is a scan going on, I'd really appreciate drilling down to that aspect as well. And
definitely.
So,
And how to deal with people, bylaw or whoever, when we can have a bylaw, but when you can't enforce it, or you don't have enough people with eyes looking at it, then it's more difficult.
Can I provide
Sure,
comment
go ahead.
on that?
Then,
So we have a tobacco reduction coordinator who can definitely take a look and kind of scrutinize where things are at. They also have a lot of information on what other communities are doing to improve in that area, so we can make recommendations. And it's interesting because a lot of people find that with just by having the bylaw, it increases or decreases smoking because it has more eyes out there. So it's not necessarily the need for bylaw staff, it's the need to educate the public so then they can control other people around them.
Okay.
Yeah.
Thank you.
Councillor
Okay,
King.
Thank you, Madam Mayor. You were looking for a possible motion. I guess is that the update our partnership? Are you, with that motion, are you asking for dollars or just collaborative effort to work together?
Just collaborative effort.
Okay, well, I'd like to move that.
We would have to move this issue to an open meeting to be
Okay.
able to do resolutions.
Okay,
so.
so we could certainly look at that. Yeah.
Move it to an open meeting. That's a motion to move it to an open meeting. Sorry, Jeff. Sorry about that. No problem. No, that's thanks.
Okay.
Move it this afternoon.
Is there anybody else that had questions of
Can't get a second.
Faith and Tanya? Well, I think we're kind of on board. We've really been looking at healthcare and all aspects of it the last couple of years. We did a study to look at whether we should be building a health center here, and so I think that it is sort of top of mind, all of these things. And so we appreciate having you come, and I definitely agree with Councillor Rhodes that if we could have the lady that has that looks at the tobacco reduction, and does that include vaping and all types of smoking?
So it does include vaping.
Okay.
If you're referring to cannabis,
Yes. That's
provincially, the health authorities actually have not been.
yeah.
Yeah, we don't really know where we.
We
sit.
get it. It's kind of too new and it keeps changing. So.
But are you involved with vaping? We're not talking marijuana.
Definitely, we're involved with
The
tobacco
vape,
and
yeah,
vaping.
yeah.
Yeah.
It seems to me that I've read quite recently that there are some severe problems.
Health issues.
Yeah, health issues with younger teenagers vaping and having major lung problems. Is that a trend? I hope not.
Well, vaping is just too new. We don't have the research to back
Okay.
anything. Recently, not too long ago, the District of Summerland did some education on vaping, and the speakers all referred to our youth that are vaping as our guinea pigs, because we will find out later on what happens. But we do know that there definitely are some health implications. We just don't know the long-term effects.
Does the lady that you have on staff, does she come down and talk to kids in the schools and that type of thing, or is that part of her job?
Yeah, she does.
Okay.
She definitely does do education, and they are working with schools and the school health promoter coordinators. But we can
to look into.
We could also have her come and do a delegation, do some education. We could have her do specific education, like the District of Summerland did.
Okay.
There's lots of options.
Thank you. Anything else? No. Well, thank you very much for coming down and visiting us and refreshing us on what we need to do. So thank you. And
Thanks for having us.
Did you have something to say? No. Okay. Sorry, you're looking like you were, so I wondered. So thank you very much, and I think that's all. So I would call for an adjournment, please. A motion to adjourn. Councillor Bennett, Councillor King, all in favor. Thank you very much, and we will.